Welcome back to Health Bulletin. Join us for another informative episode covering all the latest global medical news. A concerning global resurgence as measles infections and deaths soar by double digits in 2022. This resurgence was primarily attributed to a decline in vaccination rates, driven by the challenges posed by the COVID-19 pandemic. U.S. health official characterized the surge in measles cases as staggering. This term emphasizes the alarming and unprecedented nature of the increase in measles infections and deaths. According to a report published on November 17 by the U.S. CDC and the World Health Organization, global measles cases surged by 18% compared to the previous year. The rise in cases was accompanied by a 43% increase in measles-related deaths. Measles is an extremely contagious disease. If one person becomes infected, up to 9 out of 10 people. This high level of contagiousness makes measles particularly challenging to control. Most of the 9.23 million measles infections and 136,200 deaths reported in 2022 were among children. This underscores the vulnerability of children to the disease and the importance of protecting them through vaccination. It jumped from 22 nations to 37 nations, with 28 of them located in Africa. In response to the alarming surge in measles cases and deaths, both the WHO and the CDC issued urgent appeals. They called on countries to take immediate action to find and vaccinate all children against measles. Vaccination remains a critical tool in controlling and preventing measles outbreaks. In the vibrant heart of India, a silent threat is on the rise. Amidst the bustling streets and vibrant culture of Maharashtra, a new challenge has emerged. Zika virus cases are surging in Maharashtra. Health officials are on high alert. There have been at least 7 reported cases of Zika virus in the state. The most recent case is a 64-year-old woman from Pune who experienced symptoms like fever, body ache, rashes, and joint pain. Pregnant women are advised to take precautions to prevent mosquito bites, as Zika can lead to complications like paralysis during pregnancy or birth defects. Zika transmitted by Aedes mosquitoes and most patients are asymptomatic. Those who do develop symptoms may experience rash, fever, conjunctivitis, muscle and joint pain, malaise, and headache, which typically last for 2 to 7 days. The Zika virus was first identified in Uganda in 1947 in a rhesus macaque monkey. Next, nearly 450 patients at a hospital in Massachusetts might have been exposed to hepatitis B, hepatitis C, and HIV due to poor administration of IV medications. Salem Hospital disclosed that patients who underwent endoscopy procedures, including colonoscopies, laparoscopies, and bronchoscopies, at the hospital may have been exposed to pathogens over several years. Health authorities advised the hospital to inform all affected patients in writing about the potential exposure to bloodborne pathogens. The hospital has also been instructed to provide free of charge follow-up care, including testing, to these patients. Malaysia faces a persistent problem with dengue fever cases. Reported cases have been increasing consistently over the years, often accompanied by periodic outbreaks. Urban areas with high population densities are most affected by these outbreaks. Dengue outbreaks usually occur during the rainy season, when mosquito breeding sites are more prevalent. Until October 2023, there was a dramatic surge of 100.5% in the number of dengue cases, totaling 96,443. Tragically, during this period, 73 deaths resulted from dengue-related complications. Meanwhile, in the United States, new research reveals a troubling connection between elevated insulin, poor diet, obesity, and pancreatic cancer, the third leading cause of cancer deaths. Pancreatic cancer is the third leading cause of cancer-related deaths in the United States. New research suggests a connection between elevated insulin levels and the development of pancreatic cancer. Elevated insulin is known as hyperinsulinemia. It occurs when insulin levels in the body exceed the normal range. Hyperinsulinemia is often associated with insulin resistance, a condition where cells in muscles, fat, and the liver stop responding normally to insulin. Elevated insulin levels are linked to poor diet and obesity. Next story about the deadly toll of tobacco. Every year, more than 1.3 million lives are lost due to cancers caused by smoking tobacco in 7 countries, including India. These 7 countries, namely India, China, the UK, Brazil, Russia, the US, and South Africa, collectively account for over half of the global burden of cancer deaths annually. The study also highlights that not only smoking but also 3 other preventable risk factors contribute significantly to global deaths. These risk factors include alcohol consumption, obesity, and human papillomavirus (HPV) infections. Researchers from institutions such as the International Research on Cancer, Queen Mary University of London, and King's College London conducted the study. The study concludes that these 4 preventable risk factors result in over 30 million years of life lost each year globally. Among these factors, smoking tobacco has the most significant impact, leading to the loss of 20.8 million years of life annually. Cervical cancer is a significant concern, with a global death occurring approximately every 2 minutes. Most of these deaths are concentrated in low and middle-income countries. Comprehensive screening and HPV vaccination programs have the potential to significantly reduce cervical cancer deaths. The study also reveals gender disparities in the impact of risk factors. Men have higher rates of years of life lost to smoking and alcohol consumption, particularly in China, India, and Russia, where rates are up to 9 times higher in men than women. In contrast, being overweight or obese, along with HPV infection, leads to more cancer deaths and years of life lost in women compared to men. The FDA has recently approved the world's first Chikungunya vaccine, providing protection against this rare and painful mosquito-borne infection. Chikungunya is a virus transmitted through mosquito bites and is similar to diseases like malaria and dengue. The virus was first identified in Tanzania in 1952 but spread significantly in 2005, reaching the Indian Ocean Islands, India, causing a massive outbreak with over 1 million cases, and later Southeast Asia. In 2013, cases were reported in the Caribbean, and it has since spread throughout the Americas. Climate change has been contributing to the increased prevalence of mosquitoes and diseases like chikungunya. The vaccine, known as Ixchiq, has been developed by the French biotech company Valneva. It is administered via a single injection and is primarily intended for adults at a higher risk of exposure to the chikungunya virus. Valneva aims to start commercializing this chikungunya vaccine in the United States by the year 2024. Hong Kong Baptist University is conducting research on a novel drug containing hyodeoxycholic acid. This drug aims to address the growing issue of fatty liver disease, NAFLD, which is considered one of the urban syndromes. NAFLD has seen a significant increase, affecting approximately 28 to 30% of adults, not only in Hong Kong but also in other countries worldwide. The prevalence of NAFLD continues to rise, posing a substantial health challenge. Some individuals with NAFLD progress to a more severe condition known as non-alcoholic steatohepatitis, NASH, which can lead to cirrhosis and liver failure. Remarkably, there are currently no drugs available to effectively treat NAFLD or NASH. The research conducted by HKBU aims to develop a drug that could potentially address these pressing health concerns within the next 5 years. This development could offer hope to millions of individuals suffering from NAFLD and NASH, providing a much-needed treatment option for these conditions. Meanwhile, on the global medical front, a groundbreaking development in liver therapy emerges from China. Chinese authorities have approved clinical trials for a revolutionary stem cell-based bio-artificial liver. This therapy aims to assist patients suffering from liver failure by removing toxins from their blood. The technology is seen as a potential game-changer in treating liver-related issues on a global scale. The bio-artificial liver functions as an external device that mimics the liver's role in detoxification, protein synthesis, and digestion. It uses a bioreactor system with a hollow fiber membrane to cultivate stem cells and essential substances. These cultivated components are then introduced into the patient's bloodstream, aiding in tissue regeneration and mitigating liver damage caused by inflammation. This groundbreaking development in liver therapy holds significant promise for millions of individuals worldwide grappling with liver failure. Back on the positive side, on November 15, the FDA approved the first-ever home test for 2 common bacterial STDs, gonorrhea and chlamydia. Gonorrhea and chlamydia are among the most prevalent STDs in the United States. If left untreated, these STDs can cause permanent damage to a woman's reproductive system, potentially making it difficult or even impossible to conceive in the future. They can also lead to a life-threatening condition known as ectopic pregnancy. This approval marks a significant milestone in public health as it offers individuals an accessible and convenient way to test for these STDs from the comfort of their homes. The home test kit can be purchased without a prescription and is available for individuals aged 18 years and older. Users can perform the test at home, and the results are delivered online. In cases where the test results are positive or invalid, users are strongly advised to follow up with a healthcare provider for further evaluation and guidance. This home test approval provides an important opportunity for early detection and management of these common STDs. Thanks for watching.